If you are in your 70s or 80s, or you are helping a parent who is aiming for 120/80 may sound ideal. It may sound like the safest possible number, but for some older adults, pushing blood pressure that low can actually create a completely different kind of danger. Not a danger that shows up slowly on a lab test. A danger that shows up when you stand up too fast, when you feel unsteady, when your vision goes gray for a second, when you fall, or when you start losing confidence in your own body. I'm Dr. Elena, and today I want to walk you through why your blood pressure target changes after 70, what most doctors do not explain clearly enough about this topic, and how to tell whether the number you are chasing is actually helping you or quietly putting you at risk. And by the end of this video, I'm going to share one of the most important truths about blood pressure treatment in older adults. It is something that sounds simple, but it changes the entire conversation. Because once you understand it, you stop asking, what is the perfect blood pressure? And you start asking the much better question, which is, what blood pressure is safest for this body at this age with these symptoms? That is the question that really matters. Let's start with what changes inside the body after 70, because this is where everything begins. Most people are taught to think about blood pressure in a very simple way. High is dangerous, lower is better, end of story. And when you are younger, that is often close enough to the truth that it works. But aging changes the rules. As you get older, your blood vessels do not behave the same way they did at 40 or even 55. They become stiffer. They lose elasticity. They do not expand and contract as easily. They do not respond as quickly when your body suddenly needs to shift blood flow from one place to another. And that matters much more than most people realize. Because blood pressure is not just a number. It is a live system. It is your body's way of making sure enough blood reaches your brain, your kidneys, your heart, and your muscles every second of the day. And that system has to constantly adapt. When you stand up, when you get out of bed, when you have not had enough water, when you take a hot shower, when you are on multiple medications, when you have lost weight, when you are sick, when it is hot outside, when you have not eaten enough, your blood pressure regulation has to adjust. And after 70, that adjustment system often becomes less reliable. This is one of the biggest reasons older adults are so vulnerable to something called orthostatic hypotension. That simply means your blood pressure drops when you stand up. A lot of people have felt this without realizing what it is. You get up from a chair and feel a wave of dizziness. You stand at the kitchen counter and suddenly feel weak. You get out of the shower and feel like the room shifts for a second. Maybe you have had a moment where you needed to hold onto the wall or the back of a chair until your body caught up. Many people brush that off. They think it is just normal aging, or they think they stood up too fast. But sometimes that is your body telling you that your blood pressure is being pushed lower than it can safely tolerate in real life. And that is where the conversation becomes much more important. Because when you are 45 and otherwise healthy, a brief drop in blood pressure may only cause 2 seconds of mild dizziness. But when you are 75, the consequence can be very different. It can mean a fall, it can mean a broken hip, it can mean a head injury, it can mean fear of walking alone. It can mean loss of independence, it can mean that your world starts shrinking, not because your blood pressure was too high, but because the treatment pushed it too low for your body. That is what people are not told often enough. Now, to be clear, high blood pressure absolutely matters. It increases the risk of stroke, heart attack, heart failure, kidney disease, and damage to blood vessels over time. That is real. That is why we treat it. I do not want anyone to walk away from this thinking blood pressure does not matter. It does. But here is the missing piece. After 70, there are often two different risks happening at the same time. One is the long-term risk of blood pressure being too high. The other is the immediate, daily risk of blood pressure being too low for your body to function safely. And many older adults are caught between those two risks, without anyone fully explaining that balance. Let me show you exactly what I mean. Think about two people. Both are 76 years old. Both have a blood pressure reading of 146/86. On paper, they look the same. But in real life, they are not even close to the same. The first person is active. They walk most days. They are mentally sharp. They get around well. They do not feel dizzy when they stand. They tolerate their medication. No falls, no balance issues, no weakness, no episodes of feeling faint. For that person, lowering systolic blood pressure into the 130s may reduce the risk of stroke and cardiovascular events in a meaningful way over time. Their body can tolerate the treatment. Their circulation adapts well enough. The benefit is real. Now take the second person. Same age, same exact reading on the cuff. But this person is frailer. They are on several medications. They have lost muscle. They feel unsteady when getting out of a chair. They have had 2 near falls this year. Sometimes they feel foggy in the morning. Sometimes they avoid walking because they do not trust their legs. Sometimes they get that strange wave of weakness after standing. For that person, aggressively chasing a blood pressure in the low 120s may not be protective. It may be the very reason they are struggling. Same number, completely different risk. This is the biggest mistake people make with blood pressure after 70. They assume the cuff tells the whole story. It does not. The cuff gives you data, but symptoms give you context. And in older adults, that context changes everything. This is also why blanket blood pressure advice can be so dangerous. Because what helps one older adult may hurt another, and what looks perfect in a guideline may feel terrible in a real body. In fact, one of the reasons this topic is so confusing is that many of the studies that shaped modern blood pressure treatment do show benefit from lower blood pressure targets in older adults. Some of those studies influence the idea that aiming lower can reduce cardiovascular risk. But the problem is that the average older adult sitting in a primary care office is often more medically complex than the ideal study participant. Frailty, falls, standing blood pressure drops, multiple medications, kidney issues, changing cognition, and day-to-day symptoms do not always fit neatly into a one-size-fits-all target. Large trials like SPRINT showed benefit from intensive treatment in selected older adults, but those results were not designed to mean that every single person over 70 should be pushed to the same number regardless of symptoms or function NHLB. That is a huge distinction. Because there is a difference between saying lower blood pressure can be beneficial in some older adults and saying every older adult should be forced toward the same low target no matter what happens to them when they stand up, walk, or try to live their daily life. Those are not the same statement. And when people confuse them, older adults pay the price. Now, before I tell you what target often makes sense after 70, I want to say something very clearly. There is no single perfect blood pressure target for every person over 70. Anyone who gives you one magical number without asking about dizziness, falls, kidney function, medications, frailty, or how you actually feel is not giving you a complete answer. They are giving you a simplified answer. And after 70, simplified answers are often the most dangerous ones. If this is already changing the way you think about blood pressure, take a second to subscribe, because this is exactly the kind of health advice older adults need more of. Not fear-based advice, not oversimplified advice, but practical advice that actually reflects how aging bodies work. My goal is to help people make better decisions with their doctors, and every subscription helps get this information to the people who need it most. Now let's talk about the target itself. If you are over 70, still fairly robust, active, mentally sharp, walking independently, and you are tolerating your blood pressure treatment without dizziness, weakness, lightheadedness, falls, or fatigue, then a lower target may be entirely reasonable. For many people in that category, a systolic blood pressure somewhere below 140 Makes sense. And often the 130 when your pressure is lower, then your body is giving you information the cuff is not. And those symptoms matter. In some older adults, especially the frail, the underweight, the chronically ill, the heavily medicated, or the ones who already have standing blood pressure drops, a systolic blood pressure in the 140s may be safer than pushing into the low 120s or even the 130s. Some guidance for very old adults is also less aggressive than what many people assume. For example, NICE uses a target below 150/90 in clinic for adults age 80 and over, while also emphasizing clinical judgment in frailty and multimorbidity. NICE. The ACC has also emphasized that intensive goals can be reasonable in healthier adults over 80, but shared decision-making and closer monitoring matter, especially when cognition, kidney function, or tolerance become concerns. ACC. That is the nuance people rarely hear. They hear that lower is better. What they do not hear is that lower is better only when the body can tolerate lower safely. That is a very different message. And there is another piece almost nobody talks about enough, which is the diastolic pressure, the bottom number. A lot of people focus only on the top number, and for good reason, because systolic pressure becomes especially important with age. But if the bottom number gets driven too low, especially in someone with stiff arteries, wide pulse pressure, or existing vascular disease, that can sometimes create problems too. In very simple terms, some older adults do not do well when the pressure is pushed down too aggressively across the board. This is one more reason the goal is not to chase a perfect-looking number. The goal is to reduce risk without making the person less stable. That is the balance. Now let me tell you the sentence I wish more older adults heard in the exam room. Your symptoms should matter just as much as your seated blood pressure reading. If you are over 70 and your blood pressure looks beautiful on paper, but you feel worse, less steady, less clear, less energetic, or less safe in your actual life, then that number may not be beautiful for you. And that is not failure. That is physiology. This is especially important because many people after 70 start believing that their symptoms are just part of getting older. They think, of course I am a little dizzy. Of course I am more tired. Of course I need to hold on to something when I stand. Of course my balance is not what it used to be. Sometimes that is aging, but sometimes that is blood pressure treatment that no longer fits the body it is treating. And if nobody checks, nobody knows. So here is a very practical thing you can do at home. Check your blood pressure sitting down after you have been seated quietly for a few minutes. Write that number down. Then stand up and check it again within 1 minute. If you can, check it again at about 3 minutes. If the top number drops by 20 points or more, or the bottom number drops by 10 points or more, especially if you feel lightheaded, weak, or unsteady, that is important. Bring those numbers to your doctor. Bring the symptoms too. Do not just say, I feel off sometimes. Say, my seated blood pressure was this. My standing blood pressure was this. And I felt dizzy when I stood up. That is useful information. That is the kind of information that changes treatment decisions. And while you are paying attention to that, notice when symptoms happen. Do they happen in the morning after medication? Do they happen after a hot shower? Do they happen when you have not eaten enough? Do they happen when you are dehydrated? Do they happen when you get up at night to use the bathroom? Do they happen more when you have been losing weight? Do they happen after a new medication was added? These patterns matter, because older adults are not just dealing with blood pressure itself. They are dealing with hydration, nutrition, heat, mobility, medication timing, kidney function, sleep, and the cumulative effect of aging physiology. And that is why a number alone is never enough. Now, I want to talk about one more mistake that happens all the time. Many older adults assume that if their blood pressure is sometimes high in the doctor's office, the answer must be more medication. But office readings can be misleading. Anxiety raises pressure. Pain raises pressure. Moving around before the visit can raise pressure. Even talking can affect it. That is why home readings matter so much. And that is also why it is so important not to react to one number in isolation, especially after 70. What matters is the pattern. What matters is how you function. What matters is whether treatment is reducing long-term risk without increasing short-term danger. That is the standard that makes sense. Not perfection. Safety. Now here is the significant finding I told you I would share, and it is the one I think every older adult on blood pressure medication needs to hear. The right blood pressure target after 70 is not just based on age. It is based on age plus resilience. That means your strength, your balance, your symptoms, your cognition, your kidney function, your fall risk, and how well you tolerate treatment matter just as much as the number itself. That is the part most people never hear. They hear their age, they hear their diagnosis, they hear their reading, but they do not hear enough about resilience. And resilience is the difference between a blood pressure target that protects you and one that destabilizes you. So if you are strong, active, clear-headed, and symptom-free, your target may reasonably be lower. If you are frail, dizzy, falling, losing confidence with walking, or dropping significantly when you stand, your safest target may need to be higher. Both of those can be appropriate. That is not inconsistency. That is individualized medicine. And frankly, that is what good medicine should look like after 70. So, what should you actually do with all of this? First, do not change your medications on your own. Second, start checking both sitting and standing blood pressure if you are having symptoms. Third, pay attention to how you feel, not just what the cuff says. Fourth, look at patterns over time instead of panicking over one reading. And fifth, talk to your doctor in a more specific way. Do not just ask, "Is my blood pressure okay?" Ask, "What is my target based on my age, my symptoms, and my fall risk?" Ask, "Am I being treated to a number that makes sense for my body?" Ask, "Should we be checking my standing blood pressure?" Ask, "Could my dizziness or weakness be related to overtreatment?" Those are better questions. Those are the questions that open the right conversation. Because the truth is, the goal is not simply to make a blood pressure machine happy. The goal is to help you stay independent, stable, clear-minded, and protected for as many years as possible. That is the real goal. And sometimes that means lowering blood pressure more aggressively. Sometimes it means backing off slightly. Sometimes it means changing medication timing. Sometimes it means treating dehydration, improving protein intake, or simplifying a medication list. Sometimes it means realizing that the perfect reading is not perfect for you. That realization can change everything. If you take one thing away from this video, let it be this. After 70, the safest blood pressure target is not always the lowest one. It is the one that lowers long-term risk without causing short-term harm. It is the one your body can actually live with. It is the one that protects your brain, heart, kidneys, and independence at the same time. And that target is not always 120/80. For many people, that will be a relief to hear. For others, it will be the first time anyone has said it out loud. If this helped you, subscribe and share this with someone over 70 who is taking blood pressure medication, because there are a lot of older adults trying very hard to hit a number that may not even be the right one for them. And if you want to be proactive, start with the home standing blood pressure test I talked about today. That single step can reveal a problem that routine office readings completely miss. In my next video, I'm going to talk about one of the most overlooked reasons blood pressure becomes harder to control with age, and what older adults can do about it naturally and safely. If you want to understand about one of the most overlooked reasons blood pressure becomes harder to control with age, and what older adults can do about it naturally and safely. If you want to understand how to lower blood pressure without making yourself weaker, more dizzy, or more dependent on medications than necessary, you are going to want to watch that next. Because after 70, managing blood pressure is not just about living longer, it is about living steadier, it is about living clearer, and it is about staying on your feet.